very quick to deteriorate. Patients get deteriorated very fastly. You always have to have very high index of suspicion. Any patient who is coming to you with high degrees of temperature, with no other reasons, no infective etiology, you don't have any abscess found, you don't find any other viral or bacterial or protozoal or fungal involvement, immediately think about multi-system inflammatory syndrome, particularly in post-COVID periods. MIS is the ongoing challenge now. So all the clinicians who are treating COVID patients or post-COVID, keep this in your mind that you might deal with MIS. If you can identify this diagnosis as early as possible, you might be saving them. If you are thinking what it could be, within no time you could lose the patient. So this is about the incidence of MIS in New York. You can see how significant the cases were there in children. No surprise, this we can see in adults also. So everyone be aware and alert that COVID is not just COVID, it is gonna be everything henceforth. So post-COVID complications, this is entirely a different topic. So lung fibrosis, for all the people who had significant lung involvement, the lung has gone into fibrosis. We always have to plan this patients for lung transplantation. Mucormycosis, I think this is the challenge India was facing and is facing. Of course, we still are not clear about the reason for etiopathogenesis of increased incidence of mucormycosis and particularly COVID. So cystitis, gastro disorders, I mean inflammatory bowel disorders or irritable bowel syndrome, everyone this fits into, including with your increased dyspepsia, gastrointestinal, gastroesophageal reflux disease, gastritis per se. So we have a huge spectrum of gastro disorders which are increased because of this. And lastly, neuropsychiatric complications. Yes, I think reassurance from the doctor and a proper approach from the doctor who has a proper understanding about COVID's illness, its temporal profile of illness right from day 1 to day 28, and even after that is going to help patients much better. So my take-home message when we are dealing with post-COVID, every hospital should plan their own channel or algorithm how to deal with post-COVID. Always remember, you should have high index of suspicion, have a holistic evaluation, make sure that you are not missing any active, acute other infections, as well as prompt follow-up and multidisciplinary approach is the need of the hour when we are dealing with post-COVID. And data analysis is much required, which is lacking in Indians. So data analysis for future research work is something which I emphasize on everyone.